Hi, let's do the bones. This is Unit 6. We're going to talk about the function of the skeletal system. We're going to talk about osteoblasts and clasts. Talk about what you need to grow good bones. We'll list some of the major bones, but mostly that'll be lab. We'll also talk about joints, joint diseases, and some bone diseases. So what does the bones do for you? It protects internal organs. It produces blood cells, particularly red blood cells by the millions. It stores and releases minerals, mostly calcium and phosphate. It allows for movements because that's where muscles attach, and it supports the body. This particular website also said it stores and releases some fat, but that is not a major bone function. Bone is made up of the extracellular matter, because remember it's connective tissue. That includes the matrix, collagen fibers mostly, which is the organic part, and the inorganic or the mineral part, which is calcium phosphate, which makes the matrix hard. Okay, so bones are very solid. The cell component include the osteoblasts and osteoclasts, or sometimes generally referred to as osteocytes, bone cells. The collagen plus the minerals plus the cells make up the bone tissue. Okay. The main parts of the bone that you need to know are listed here. The ends of the bones are called the epiphyses, and it usually is covered by articular cartilage, or that white knuckle-like stuff you see at the end of chicken bones. Okay. If that articular cartilage breaks down, then the bones rub against each other, and that's arthritis, which we'll talk about later. Inside the epiphyses, it's made of spongy bone, and that's where the red bone marrow is located and where blood cells are made. The shaft of the bone is called the diaphysis. It does have a cavity called the medullary cavity that contains yellow marrow in it, but it is made out of compact bone rather than spongy. Both compact and spongy bone are quite strong, so don't think of spongy as weaker just because compact bone is more solid. Here's a cross section of a bone. You can see the compact bone around the outside and spongy on the inside. Microscopically, when you look at bone, the bone cells are located in spaces called lacuna around layers that grow around a central canal or a blood vessel there. You can see the blood vessels, looks like tree trunks a little bit. Those are called lamella, and the little gray darker spots are lacuna, or spaces where the bone cells are. Osteoblasts build bone, and osteoclasts chew it up. Your bone is continually being built and chewed up, always kind of reshaping it or remodeling it all the time. Here's another good close-up of a bone histology slide, or a microscopic picture of bone. You can see the layers. The dark spots are the spaces called lacuna where the osteocytes are located. Bone development starts in utero, and it either starts as connective tissue or cartilage, and is quite soft compared to the fused bones we think of much later. It's not till almost 25 that your bones are completely fused and ossified. They're quite soft as a child, more bendable, harder to break actually, but gradually become quite hard and strong. Again, that continues all the way to adulthood. What do you need to get good bone growth? You need calcium. Calcium and phosphate, which you get from your diet. It's balanced by parathyroid and calcitonin. Those hormones you probably remember, that from one of the earlier units. But you need those hormones in order to keep the amount of calcium in your blood adequate for bone growth and development. You need vitamin D to help you absorb the calcium. You can make it if you're exposed to the sun, but most of us in Michigan really don't have enough sun exposure to make enough vitamin D, so you should consume it in your diet. You also need vitamins A and C to make the collagen. Okay, so vitamins A and C. You need the hormones growth hormone, thyroid hormone, and steroid hormones, estrogen and progesterone. Thyroid hormone is so important in bone growth that if you don't get, or if mom doesn't have enough thyroid hormone and you don't get enough of it during development, your bones will not be developed correctly, but you also have mental retardation issues. So pregnant women are tested for thyroid hormone levels to make sure they're adequate, because it's easy to give somebody thyroid hormone. You can take that one by pill. Another thing, weirdly, that you need for bone growth that you don't think about necessarily is exercise. When you move an arm or a leg, the muscles pull on the bone, and that actually induces a little bit of growth. Sadly, they found some of this out in orphanages where babies were basically left in a crib until age 2. They didn't get to move around or run. Those children all ended up very short in stature. Their bones just never developed fully and were never able to reach their full potential size. Okay, so you really need to have these things and to have good bone growth. Vitamin D has been in the news a lot lately, and vitamin D deficiency has been shown to be in young people. And they're worried about this because it won't lead to good bone deposition or mineralization, which can cause problems later, because if you're low bone density can cause osteoporosis when you're older. But bone needs to be laid down and calcified when you're young. However, I was looking into this, and there was a study that suggested individuals, healthcare providers, and policymakers should make public health measures and develop communication and tell people, prevent this by telling young people to get vitamin D, because it showed people aged 20 to 29 had deficiencies. I looked into it further, and they talked about, vitamin D is so deficient in young people, particularly teenagers, and a lot of problem in African Americans. It was more of a problem in the winter, but was common all across the world. What do we do? What do we do? And other studies say we don't even know what a good level of vitamin D is. Perhaps we think it's higher. It should be higher than it should be. So of course we all look deficient. Other studies have not shown that it's correlated to things later. So there's a lot of controversy about vitamin D and whether are we all really low? Do we really need more of it? However, it has been linked to the immune system, and there was definitely a correlation. People who had COVID were more likely to die of COVID if they had low vitamin D. So perhaps there's a connection to the immune system we haven't figured out yet. Anyway, one of the reasons they think that we're vitamin D deficient is that we don't spend very much time outside. We're just more indoors now, and we play on our phones rather than play outside. However, we could get vitamin D from our diet, but we're not eating as many leafy vegetables. We don't drink as much milk. We drink more pop and fruit juices, for example, and that has less vitamin D. So some of it might be just it's gone down because A, we're not outside, and B, we're not eating it. Anyway, there's quite a bit of regulation when it comes to the amount of calcium, because too much in your blood could cause Charlie horses, too little can make it hard to send nerve impulses or contract a muscle or clot your blood. Calcium is used in a lot of things. Parathyroid hormone makes your blood calcium go up. Basically tells your bones to release it, your kidneys to save it. And calcitonin does the opposite. It tells your calcium levels to go down by making your bones soak it up and your kidneys pee it out. Okay, and vitamin D helps raise calcium levels by increasing absorption. So you can get all the calcium in the world. If you don't have enough vitamin D, you can't absorb it. Alright, so in summary, what are some of the things that make up bone? Okay, you should remember this is the cells, the collagen, and the minerals. What two types of bone cells remodel bone? Osteoblasts build and osteoclasts chew it up. What minerals released or absorbed during bone remodeling? Calcium, okay, calcium phosphate. And if you want to check some of these things out, don't be afraid to check out this link. It's a cool little video explaining some of this. All right, we're going to talk about osteoporosis and then go on to some joint stuff. Osteoporosis is when your bones get less dense because the calcium is released. And the people who are at risk at this the most are older white women, okay, older than menopause, particularly those who smoke or are very thin. Not that Asians and African Americans and men can't get osteoporosis, but menopause really increases your risk of osteoporosis because estrogen is very protective. It turns off the osteoclasts, which chew up bone. And when menopause hits, estrogen levels go down, and now you don't have any check on those osteoclasts. Smoking, alcoholic, or people drink a lot, people who don't exercise a lot, there's also genetic components. So those all are also some problems. So often you don't even know you have low bone density until a minor fall or a bump causes a fracture. And so they'll do a bone density scan and they'll look at it and like, oh, you have really porous bones. Like in this picture here, you need to eat more calcium. The problem is, sure, you can increase your calcium intake and get more vitamin D, but the osteoclasts are still pretty active because you can't get that back after menopause. And so you really need to have good bone growth and good dietary habits when you're 15 to 25 or so, especially women. So if you're listening to this and you're 18-year-old girl, drink your milk or get your calcium from yogurt or cheese or whatever, because you need to build that up now to be safe later. Also, exercise, remember, can induce bone growth, so they're now suggesting that people who have osteoporosis or are at risk for it, even light exercise can kind of turn on those osteoblasts and help build some bone, even while your class might be chewing it up. All right, the second part of this PowerPoint, so this is a good time to take a break if you need to, is going to talk about the bones themselves and the joints. I'm not going to go over the bones too much because that is pretty much your lab activity, but this picture right here shows all the major bones, and the list that you need to know is in your master list, but also under the bone lab. There'll be a list there of the bones that you need to be able to identify. So go check those out in your lab book. There are different types of joints in the body, and we're going to focus on the synovial joints. However, there are fibrous joints that include the sutures, the syndesmoses, and the gomphosis joints. They don't move. For example, a fibrous joint is the one between your tooth and your jaw, and you should never have movement there. Obviously, if somebody hits you hard enough or you get hit hard enough in the mouth, your gomphosis joint might loosen up and you'll lose a tooth. But in normal times, the fibrous joints don't move. Cartilaginous joints barely move. The symphysis pubis, which is the joint between your two pubic bones, will loosen under the effects of relaxin, which is a hormone produced when women are pregnant. And that allows for the birth canal to be a little bit bigger. But again, it's not something that generally moves. So we're going to focus on the synovial joints. These are all the movable joints. And we're going to talk about the different kinds of those and what movements they do. So, a synovial joint has two bones, and each bone is covered by articular cartilage, and that's in blue in this picture here, with a space in the middle called a joint cavity or a joint capsule filled with synovial fluid. Okay? And that cushions, protects, and lubricates the end of the bone so they can easily move against each other. Ligaments go over top of the joint cavity and attach a bone to a bone. Okay, so on the outside of the articular cartilage or articular capsule here, you might have a ligament or one from the top bone over top of this capsule to the bottom bone. Okay, so that's the basic parts of a synovial joint. The types of synovial joints include ball and socket, condyloid joints, sliding or plane joints, the saddle joint found in your thumb, a hinge joint, and a pivot joint. So those are the 6. I'll show you pictures of each one. The ball and socket, which is your hip or shoulder joint, have the widest range of movements. You can do the most types of movements with a ball and socket joint. Movement in all planes, your hip and your shoulder. A hinge joint is like a door. It only moves in one plane. Good example are your elbow and your knee. Also, your finger joints are hinge joints. The main movements are flexion and extension. The next one is a gliding or sliding joint. These are your wrists and your ankles. Okay. Movement is back and forth or twist a little bit. The condyloid, or sometimes called elliptical joint, the condyloid or projection of one bone fits in a cavity or a divot in the next one and allows for movement in different planes, not complete rotation, but for example, if you put your pointer finger straight out and draw a circle with the end of your finger, that's called circumduction, and that joint, the one between your lowest phalange and the first metacarpal, okay, where your palm of your hand is, that's a condyloid joint. Okay, so these right here in this picture are in the palm of your hand, and then what you can only see a part of, this is the bottom part of your finger. That joint, the blue one there, is condyloid. A pivot joint is kind of like a circle on top of a pin in this picture right there. A good example are your top 2 vertebrae. The top one will rotate back and forth on either side of this pivot. Okay, so you have rotation around an axis. Another example is the radius can turn against the ulna there. And last, you have a saddle joint. Saddle joint is your thumb. The saddle joint allows back and forth, up and down. It does not allow for rotation like a ball and socket, but has quite the range of movement. So, the different types of movements. Normally, if I was in class, I would demonstrate this, and I'm not going to be able to, obviously, here online. So you should go online and type this in, and you can watch it happen if you don't understand what I'm saying. Flexion and extension is what the little dude in the picture is doing there. Flexion is when you bend your elbow, and when you extend it, that's extension. Okay, flexion, and that's a hinge joint that does that. Adduction is like doing jumping jacks. When your arms and legs go out, that's abduction. And when you bring it back, you add it back to the body. When your arm's hanging down and your legs are together again, that's adduction. Okay, abduction is away from the body. Adduction is back towards the body. Rotation is going around. Your arm can rotate almost completely, 180 degrees. When you shake your head no, that's also a kind of rotation. Circumduction is when you're like your finger and you draw a circle in the air with your pointer finger. That is circumduction. There are other types of movements, but these are some main ones. If you work as a CNA or a medical assistant or maybe even a nurse would do some of these movements to patients who are bedridden. It helps keep their muscles from atrophying or getting bed sores. Anyway, these types of movements are done with synovial joints, which is what we're talking about here. Last, a very common joint disease is osteoarthritis. The biggest risk, getting old. And pretty much we're all doing that every day. In fact, if you use your joints more, you are more likely to have osteoarthritis. Basically what happens is the articular cartilage at the end of the bones, and you can see this in the picture here, starts to break down, and so when you flex that knee or move that knee, the bones rub on top of each other. And when bones rub on each other, there's lots of nerves and blood vessels there. It's very painful. It affects millions of people and there is no cure. Signs and symptoms are achy or pain in the joint. It can lead to fatigue. Usually exercise or moving around will help because it increases blood flow. But many people don't feel like moving because it hurts to move. So then they don't move as much and it continues to hurt and they gain weight and then that causes more pain because now there's more pressure. It's kind of a vicious circle and that can be very annoying for people. The most common treatments are NSAIDs, which is non-steroidal anti-inflammatory drugs, otherwise known as ibuprofen. Okay, so ibuprofen, aspirin, Tylenol. There are some stronger prescription drugs that are used. Some people use heat or ice, massage. The only permanent fix is joint replacements, like a knee replacement or a hip replacement, which can cause, or which, are major surgery, but can really give a person a lot of relief. There are experimental treatments, growing new cartilage, injections of hyaluronic acid, other types of things being tested because it does affect so many people and nobody likes to be in pain. Anyway, that is the end of Unit 6. Check out your reading assignments, the Quizlets, Google, Canvas, and as always, if you have questions, please email me.